We learn a little bit more about causes of affective loss in aging. So actually we see that receptors are changing with age, that most receptors, they're actually down-regulated as we age, so we express less and less receptors there. But some of the receptors, they're also upregulated. So there are like at least 6 or 7 receptors that we know that are increasing in numbers as we get older. So we don't exactly know what this means and for which odors this is important, but research, as I'm trying to say here, research is developing in that area, and we learn more about age-related affective loss, and that also may lead to new research strategies, so to prevention of age-related loss. And one thing that we do currently is that, which seems to be promising, is like the exposure to odors seems to be helpful in the prevention of age-related loss. So if you expose yourself to odors consciously every day, like 2 times a day or more, to certain odors, then this may help to keep your affective function at a certain level, which also has then tremendous effects on enjoyment of food, of course. So if you can't smell, then you have no aroma perception, then food tastes all bland. So it may have a dramatic effect on society in that way. So I think it's more and more people understand that affective loss is not just something that's happening at the peripheral level, but something that is happening also at the brain level, at the level of the affective bulb. And this is changing also the view on affective function, and this may also then finally also produce new therapies, how we can prevent and cure then affective, or help people, maybe not curing, but sort of improve affective function after an affective loss. I'm very certain that it will help predict success of treatment. We're also working currently, there are a couple of developments underway on predictors of the prognosis of affective loss. And there's more and more of that is accumulating, that comes from psychophysical tests to electrophysiology, and also to look at morphology in the brain. So taking all that together, we can get a much better idea about the prognosis of affective loss in patients with smell disorders. That's already today. And currently, this will improve in the future if you add some genetic components, if you add components at the structural level, at the olfactory receptor neurons. So this is going towards personalized or individual differences in affective function. We can explain that better. And finally, this may also help to explain affective loss in certain diseases in a better way. It would mean that we are better in telling them about the prognosis, and maybe, but this is really far out. So maybe that we have more specific therapies for certain phenotypes of the disorder. So currently there's little has been established on terms of affective therapy. And we so more or less try that in terms of therapy to all patients that we see that sort of fit into this and that corner. But it's, in the end, it would be, and I'm very optimistic about that we have certain subgroups of affective disorders, and then we will be able to develop certain therapies that are the specific treatment for these subgroups of affective disorders.